And following the crash at Bradley, the state health department issued a warning to residents that the foam used to fight the fire had actually made its way into the Connecticut River, bringing with it the toxic chemical called PFAS.
Well, PFAS has been at the center of water issues in Westfield for years, with local advocates fighting for further research into the impact the chemical has on health. Western Mass News reporter Sabrina Riley has more.
The AFFF that is used to put out and contain fuel fires helps to keep the fire from reigniting.
AFFF is the substance that was used to help contain the fuel fire that broke out at Bradley International Airport following the tragic crash of the B-17 aircraft on Wednesday.
It's, very effective in, keeping fuel fires contained, but it's highly, highly toxic.
Co-founder of Westfield Residents Advocating for Themselves, Kristen Mello, tells Western Mass News that although the foam is highly effective, it comes at a cost.
There's a lot of work being done to test the toxicity of various PFASs, but there are 5,000 in use today.
It's the same foam used to fight fuel fires around the nation, including right here in Westfield at Barnes National Air Base.
It's really the tip of the iceberg, because when you think about it, they had to do the same fire training at their airport that we had to do here. So in addition to this, tragic crash and this tragic loss of life and injury, we have compounded a tragedy by adding chemicals that we know are poison into the water systems down there.
Currently, over 500 Westfield residents are awaiting their results from a study being conducted by the Federal Agency for Toxic Substance and Disease Registry.
Those answers should start coming back to us in the spring. But again, these are only numbers that tell us how much is in the blood or urine. It doesn't say what has happened to us because of this contamination.
Mello says, unfortunately, Westfield was not chosen for the second round of testing, which has forced them to take matters into their own hands.
Right now, we're working with our researchers at UMass to try and piece together smaller bits of those research components in order to create a health study for ourselves.
The next step will be securing the funds from the state on their way to finding answers on the true impact of PFAS on health.
We really need to start to talk about the environmental and public health crisis that this actually is. It's not a threat of us being exposed. We have been exposed for decades, and we need to address it sooner rather than later.
In Westfield, Sabrina Riley, Western Mass News.